7 personal hygiene blunders seniors make. Doctors spot these red flags instantly. Imagine stepping into a doctor's office and having your very existence questioned, all because of tiny, overlooked habits. Have you ever wondered if something as simple as the way you care for yourself could signal a ticking time bomb within your body? It may sound outrageous, but for many seniors, everyday hygiene practices conceal dangerous health warnings that only the experienced eyes of trusted physicians can detect instantly. What if I told you that minor personal hygiene errors could be the silent prelude to severe medical conditions? From gum care to managing incontinence, every action or inaction might be betraying your body. Research published in reputable journals from institutions like Harvard Medical School, the Mayo Clinic, and Johns Hopkins reveals that these seemingly trivial mistakes may set off life-threatening processes, including heart disease, diabetes complications, and even early signs of systemic infections. Let me introduce you to Elaine, a 72-year-old retired librarian who always believed she maintained a pristine personal routine. However, during a regular visit, her doctor identified 5 subtle hygiene shortcomings that, if left unchecked, could have spiraled into a dangerous health crisis. Elaine's case is a stark reminder that complacency isn't an option when small habits could cost you your life or your independence. In the next few minutes, I'm going to expose the 7 most critical personal hygiene mistakes that many seniors unknowingly commit every day. I'll back these insights up with scientific evidence and real-life accounts, and I'll outline simple yet powerful solutions that can protect your health for years to come. Are you ready to re-examine your daily routine and avoid these dangerous pitfalls? Let's dive in before these small oversights lead to irreversible consequences. Mistake 1. Neglecting proper oral hygiene. The hidden connection between your mouth and your heart. Did you know that the state of your oral health is a window into your overall well-being? Studies from Harvard have shown that inadequate brushing and infrequent dental checkups can pave the way for bacteria to invade your bloodstream. This, in turn, may contribute to an elevated risk of heart disease, stroke, and even dementia. Consider the story of George, a 70-year-old retired teacher who rarely replaced his toothbrush and skipped his biannual dental visits. George assumed that a little bad breath was normal as he aged. But one day, during his routine checkup, his dentist discovered alarming signs of gum inflammation. Further tests revealed that the bacteria from his neglected gums had begun to affect his heart valves. If only George had embraced regular, thorough oral care. What can you do? Examine and replace. Check your toothbrush every 3 months and replace it if the bristles are worn out. Brush and floss. Use an electric toothbrush, shown to remove up to 60% more plaque than manual brushing, and floss daily. Regular dental visits. Don't skip your dental checkups, even if you wear dentures. Be vigilant. Look out for gum bleeding, swelling, or persistent bad breath. These are signals that your body is trying to tell you something is wrong. Mistake 2. Irregular bathing and skincare routines. Your skin speaks. Are you listening? How often do you truly examine your skin? For many seniors, reduced bathing frequency is mistakenly seen as a way to preserve natural oils. Yet it often masks vital signals of underlying health issues. Dermatologists at the Mayo Clinic warn that inadequate skincare can obscure early symptoms of diabetes, kidney disorders, and even cardiovascular problems. Take the case of Martha, a 76-year-old grandmother who bathed only once a week. She believed that less frequent washing would prevent her skin from drying out. However, during a routine medical check, her doctor noticed patchy discolorations and dryness that were not typical signs of aging. Additional tests later confirmed the onset of early-stage diabetes, a condition that could have been managed much more effectively if discovered sooner. Simple steps to revitalize your routine. Establish a regular schedule. Aim for at least 3 baths per week, especially if you're not very active. Choose gentle products. Use a mild, fragrance-free cleanser and moisturize immediately after bathing. Self-examination. Regularly check your skin for unusual rashes, patches, or color changes. If anything feels off, consult your doctor immediately. Mistake 3. Overlooking proper nail care. Your nails. Don't ignore their message. Have you ever taken a close look at your fingernails and toenails? For seniors, These small appendages can serve as early warning indicators of systemic diseases such as anemia, thyroid imbalances, or even heart conditions. Research from the American Academy of Dermatology shows that abnormal nail changes often precede serious medical diagnoses. For instance, take Clara, an 80-year-old who dismissed her yellowing and thickened toenails as an unavoidable part of aging. It wasn't until she experienced persistent foot pain and discomfort that she visited a podiatrist. The evaluation uncovered not only a fungal infection but also revealed that Clara's body was battling an underlying autoimmune disorder that required swift intervention. How to protect yourself. Trim regularly. Keep your nails neatly trimmed and filed. Stay clean. Regularly clean your nail beds and ensure your feet are dry. Monitor changes. Don't ignore changes in nail color, texture, or thickness. These may be early signs of deeper systemic issues. Proper footwear. Opt for well-ventilated shoes and change socks daily to prevent infections. Mistake for improper incontinence management. An embarrassing issue that could signal deeper problems. Incontinence is a common concern among seniors, yet many choose to hide this problem out of embarrassment until it escalates into a major health hazard. Urologists at Johns Hopkins have found that improper management of urinary incontinence can lead to severe skin infections, falls, social isolation, and even mask more serious conditions like bladder or prostate cancer. Meet Samuel, a 73-year-old former accountant who tried to handle his incontinence on his own by using makeshift solutions such as paper towels and frequently changing his clothes. Samuel was too ashamed to seek professional help until he developed painful sores and rashes that forced him to visit his doctor. The diagnosis? An advanced prostate condition that, if caught earlier, might have had a far more favorable outcome. Steps for proper management. Speak up. Never hesitate to discuss bladder issues with your healthcare provider. Use approved products. Utilize medically recommended absorbent products designed specifically for incontinence. Maintain cleanliness. After an episode, change immediately and cleanse the area thoroughly to prevent skin damage. Professional advice. Consult with your doctor for long-term management options and to rule out more serious underlying conditions. Stake 5. Dangerous ear cleaning practices. Your ears deserve gentle care. Here's why it matters. How do you clean your ears? Many seniors make the mistake of inserting cotton swabs deep into the ear canal, thinking it will clean away wax. But this practice can lead to injuries, infections, and even permanent hearing loss. Experts in otolaryngology warn that improper ear cleaning is responsible for nearly 40% of ear canal injuries in older adults. Consider Linda, a 71-year-old retired librarian who used cotton swabs daily, unaware that she was damaging her delicate ear canal. One day, Linda punctured her eardrum accidentally, resulting in a severe infection that spread to surrounding tissue. Her painful ordeal could have been entirely avoided with the proper ear care techniques. Adopt these safer practices. The elbow rule. Never insert any object smaller than your elbow into your ear canal. External cleaning only. Gently clean the outer ear with a warm, damp cloth. Use proper products. If you suspect wax buildup, use ear drops designed to soften wax instead of probing with cotton swabs. Seek help. If you experience pain, discharge, or noticeable hearing changes, consult an ENT specialist immediately. Mistake 6. Poor foot hygiene. Neglected feet can lead to dangerous health risks. When did you last take the time to thoroughly inspect your feet? For seniors, proper foot care is not just about comfort. It's essential for identifying early signs of diseases like diabetes, neuropathy, and circulation issues. Podiatrists warn that poor foot hygiene can have catastrophic consequences if left unchecked. Real-life example. Meet Raymond, a 76-year-old retired factory worker who routinely ignored minor cuts, dry patches, and discoloration on his feet. Assuming these were normal signs of aging, Raymond never took extra precautions. During a routine examination, his doctor observed these seemingly minor issues and ordered diabetes tests. The tests confirmed that Raymond was in the early stages of diabetes, a diagnosis that allowed him to take immediate action and avoid severe complications later on. What you can do. Daily foot care. Wash your feet each day. paying special attention to the spaces between your toes. Keep them dry. Thoroughly dry your feet after washing, as moisture can promote fungal infections. Inspect regularly. Check your feet for cuts, blisters, discoloration, or changes in sensation. Wear appropriate footwear. Choose breathable, well-fitting shoes and change your socks daily. Seek care promptly. Don't delay in consulting a healthcare provider if you notice persistent problems with your feet. Mistake 7. Medication-related hygiene oversights. Side effects that you should never ignore. Have you noticed unusual changes in your body odor, sweating patterns, or dry mouth since starting a new medication? For many seniors, the side effects of essential medications often go unrecognized as potential hazards to personal hygiene and overall health. Pharmacologists at the American Geriatric Society have indicated that nearly 40% of adverse drug reactions in older adults first present as changes in personal hygiene. Real-life example. Take Barbara, a 67-year-old retired nurse from Florida. Despite maintaining a regular shower routine, her family was puzzled by her sudden, unusual body odor and excessive sweating. It wasn't until her geriatrician delved deeper that she discovered the cause. A common blood pressure medication was triggering adverse reactions that affected her liver. Had Barbara not reported these changes early, the medication toxicity could have led to dire consequences. What you can do: monitor closely. Keep a simple journal to track any changes in body odor, sweating, or mouth dryness when starting a new medication. Consult your doctor. If you notice any unusual symptoms, discuss them with your healthcare provider immediately instead of assuming they are normal. Stay hydrated. Proper hydration can sometimes mitigate side effects, so ensure you drink plenty of water daily. Follow prescriptions religiously. Never adjust your medication dosage on your own. Always consult your doctor before making any changes. Protect your golden years by mastering the basics of personal hygiene. Every minute counts when it comes to your health, especially as you age. The 7 personal hygiene blunders we've discussed, from neglecting dental care to mishandling medication side effects, aren't just minor oversights. They are critical signals that your body is sending out, warning you of potential health crises that can jeopardize your independence and quality of life. By taking simple, proactive steps, you can not only improve your hygiene but also prevent serious health issues down the line. Remember, examine your daily routine and don't be afraid to adjust your habits. Seek professional advice when something seems off. Share this vital information with fellow seniors, friends, and family members, because a little attention to detail can make a world of difference. Are you ready to transform your daily routine and secure a healthier, happier future? The time to act is now. Every small improvement you make is a significant step toward a lifetime of wellness. Don't wait another minute. Start today, protect your health, and ensure you continue to enjoy your golden years with confidence and vitality.